Welcome to Concussion Talk Podcast. I'm Nick Mercer. This is episode 57. I'll be talking to Dr. Jessica Schwartz.
Concussion Talk Podcast is presented by HeadCheck Health. HeadCheck Health bridges the gaps in concussion care through simple, powerful technology. Join organizations like the Canadian Football League, Track Factory Racing, the Canadian Junior Hockey League, Eastern Washington University, and Volleyball Canada, who rely on HeadCheck Health to improve communication and optimize care. Visit headcheckhealth.com for more.
Hi and welcome. This is episode 57. I'm talking to Dr. Jessica Schwartz, who is a physical therapist and is the host of Concussion Corner Podcast. And Jessica, Dr. Schwartz, can you please just tell everybody, introduce yourself better than I just did, more information about you and how you got your concussion, what got you started in the concussion space.
Of course. Hey, Nick, thanks for having me. And, it's, I think we're doing a pretty good job right now. I'm in New York City and you're in Canada. And I think this is what they call social distancing.
Yeah, yes.
So, just for folks to get to know, I met Nick, I suffered a concussion in 2013 and around 2013, 2014, I started looking online and I actually found Nick and his story.
I should mention that you were on episode 10 of Concussion Talk Podcast. So, sorry, go ahead. You're one of my first guests, episode 10. So, thanks.
Nick, did I do that? Did I do a concussion talk with you guys?
You did. You did Concussion Talk Podcast. You talked about the rear end that caused you. Sorry, my head.
Wow.
That caused you a concussion, and this was before you went into EIM.
That's right.
And,
oh my gosh.
And way back then, and just when you just started out, didn't have Concussion Corner Podcast then.
That's right. Yeah. So I'm a physical therapist here in New York City, and I did my residency in orthopedics at NYU, and was at a lovely company that I was working with, and made junior partner the week I got rear-ended by a car here in New York City. So it was an unlicensed driver, totally unsuspecting at a red light. I was totally stopped, didn't see anything coming, and totally changed my life. So while I was doing about 10 to 14 hours of rehab a week for 14 months, I was like, man, we've got to really be able to do this better. I started reaching out and kind of being a voyeur because I was a little bit nervous about being a healthcare provider and interacting on these, social media support group sites. But I learned so much from listening and watching and kind of living what other people literally around the world were doing. And I think in those Facebook support groups, I think there's over 10,000 people now. It's insane. And the story is not too different from 2013 when I went through my journey to 2020. So I kind of said, hey, while I was really sick, I was like, how can I make this better? So I started the world's first concussion education program for clinicians. That's year-long post-professional and interdisciplinary, and that was from 2015 to 2018.
Post-professional for whom? For just doctors or physios
providers? So everyone, physician to physio and athletic trainer and everybody in between.
Okay.
And that finished up in 2018. So I said, okay, so that program wrapped up, and how can I keep this going while I work on some small projects behind the scenes? So I started Concussion Corner Podcast. Actually, probably got everything together within about 2 to 3 weeks. Once I was asked to host the Concussion Summit at the 2018 Super Bowl in Minneapolis, Minnesota. So I kind of put everything together for that time, and we launched during that week. And the rest has been history. We're coming up on 40,000 downloads, and we're in over 40 countries, from literally Myanmar to Denmark and Canada and everywhere in between. So it's been a very humbling experience to be welcomed by a community, and kind of laying the groundwork for, a consistent voice and advocate, for folks that need a consistent voice and advocacy in the brain injury world.
Exactly. No, that's great. Yeah. So, just on terms of your podcast, I mean, because you told us a bit before if people want to listen to episode 10 of Concussion Talk Podcast, or find Concussion Corner Podcast, and I'm sure you talk about your injury on episode 1 of that, I'm sure, do you?
I actually don't. So I actually just go right into it, and I speak in episode 1 of Concussion Corner, the podcast, that you can find on everything from Apple to Google to Spotify, and literally iHeartRadio and everywhere that has a podcast pretty much. I actually go right after the narrative story of concussion. So I speak to Dr. Jeff Kutcher, who was the leading neurologist, one of the leading neurologists that led the fight to essentially define concussion and talk about concussion. And in 2004, American Academy of Neurology didn't even want to have anything to do with the word concussion, despite it being a brain injury as we know it today. So he really led the good fight and got concussion in. And neurologists in this country of the United States started getting formal training in concussion and traumatic brain injury in 2015 in the United States, which is pretty mind-boggling, considering what we've lived through and all of the unknowns and gray areas, no pun intended, that we have in brain injury. So, I saw my role as literally, okay, how can I disseminate sound, trusted, interdisciplinary conversations for healthcare advocacy in sports to make sure people are just getting sound, free, open access medical education, which is a movement I work with on social media called Foam Ed, to get sound facts out there, just because there's a lot of garbage that has been pushed out there by publicity and sports narratives that just aren't helpful or real. So what I realized is that folks that were on Medicaid and the poorest of poor, and folks that are Division I athletes or Olympians, gold medal Olympians, were having the same issue of finding good healthcare. So I really just hope to spread the good word of what to look for in a clinician when seeking assistance, and what clinicians who they should try to emulate to be like, and or surpass in 2020, so we can help patients for today and tomorrow.
Okay. So you mentioned gray areas, and so have you talked to many neurologists or just brains PhDs in neurology or in any brain science? You talk to scientists, or do you talk to any doctors and physicians and physical therapists on your podcast?
So we talk to everybody, and primarily it's been physicians of all types and physical therapists, especially in the vestibular and sports world. Karen Skopp has been on, who's lovely. Lenore Hergetz out of MGH. Karen Skopp's out of the VA in Tampa. She formed the first green team for TBI in this country, and she's a lovely.
What does green team mean?
Green team is basically the brain injury team for the Veteran Affairs for the VA in the United States. So all of our veterans. So she led that work down at the Tampa VA. And everyone in between. We're going to have occupational therapists on. We've had athletic trainers, researchers, scientists, clinician scientists, just to literally have a conversation of, hey, what's going on in the world and what's your research, and to try to disseminate their research. Because if you are in the academic world, you realize about an average of 8 to 9 people will read a paper, a white paper, a research paper in this world. And what one of them's got to be your mom, right? Yeah. And then, so we want to be able to disseminate this information that can take anywhere from 8 to 10 to sometimes 14 to 17 years to disseminate. So if people are publishing,
it's too long,
really good work. How do we get this information out there quicker? So I'm hoping to get sound, trusted resources out to our listeners as quickly as possible, just so they can, knowledge translate this into the clinic next day for our patients of today and tomorrow. So hopefully our patients will suffer less.
Well, I want to ask you that disseminating this information to is really translating scientific and academic papers into when people actually hear the information and understand it. Where do you feel is the best Do you feel the podcast? Which way do you think is the best way to do this? Sorry, I have a bit of a stuffed nose. Do you feel the podcast is the best good way to do this, or do you think another way like doctor, just I guess single doctor to single patient is not really efficient, but
So do you mean which is the best way to disseminate this information?
Do you think podcasting may be one of the best ways?
Yeah, so I think there's no one answer, and I think it's like if you're a doctor of any sort, like I'm a physio, I'm a doctor of physical therapy, there's a lot of different ways I can treat things, right? So for example, a low back or a ankle, for example, and a lot of people tend to understand an ankle sprain a little bit better than a brain injury. So I try to make this correlation, with an ankle. If you have a high ankle sprain, you're not going to just go and play soccer the next day. You've got to rehab that ankle, and you've got to take care of it. And we don't just start jumping on an ankle or single leg hopping or squatting on a sprained ankle. We rehab it, we rest it, we ice it. We still use it, but we are careful and we have restrictions. And a lot of people don't realize because the brain isn't.
You'll feel it. You'll feel the ankle even years later. You'll be like, oh yeah, I broke my ankle. I forgot that. You remember
that can happen. Yeah. Absolutely. Yep, that can happen.
Yeah.
But with like a really acute ankle sprain, you hope for that, that it will just go away, and oftentimes they don't. So you have to rest it, ice it, compress it, elevate it, and then we rehab it. We put our hands on that ankle, we mob it, we move it around, we stabilize it with our hands, and then we work on, doing that structurally with our muscles and ligaments and tendons as they begin to heal. And we know, tissue healing takes about 6 to 8 weeks just to heal things in healthy people with no other comorbidities. So it takes, if you have a scar, that tissue really takes about 6 to 8 weeks to heal fully, and sometimes we can only get 80% best on tissue healing. Well, with brain injuries, a lot of people didn't realize, and it wasn't until 2017 that we internationally said this, although physios have known this for a very long time, that you can rehabilitate a brain injury, and a concussion is synonymous with a brain injury. It's synonymous right now with a mild traumatic brain injury, despite there being nothing mild about a traumatic brain injury. It's kind of like having a mild pregnancy or a mild diarrhea. We don't really have mild ones of those things. But so the most people don't realize that you can rehabilitate a brain injury, and we see this from an acute standpoint to out 5, 10, 15, 20 years. Someone might have some ocular motor vision vestibular issues and or a neck whiplash injury, and it was never addressed, and we can actually address those things and make people feel better and function better. So if that's, if there's one person in the world that, I can change, then that would be great. But there's no really one way to rehabilitate someone, just like I think there's no one way for dissemination of information. But right. I think in this day and age, I think the podcast is an excellent free open source for people to use on their way to work, in the gym, and so on and so forth. But I also think things like other social media things like blogs and static social media things like Instagram or Twitter that you can use picture or video with is great. But just knowing that wherever you're visiting, it's a safe space to consume that information. You just want to make sure that is vetted, because quite frankly, most people don't have access to or the time to access a university library. And one article can be over $40 per article if you don't belong to one of these university libraries. So we need folks like yourself and myself to break this information down and disseminate this information to the masses, because a lot of people just don't have access to it.
So how do you I know people, I often get people asking to be on the podcast, or to certain people to come on the podcast. Now I get like all sorts of emails and stuff, and unfortunately I can't answer all of them. But
what was the question, Nick?
It wasn't a question yet, but how do you decide which people who you will ask on your podcast?
Oh, sure. Yeah, it's a great question. I straight up ask every single person on my podcast to come on. I know most of these folks either through social media or in person, and conferences. It's a very, very small world of this concussion world. So there's internationally. So most of us kind of get a feeling or a sense of who each other are.
Yeah.
And my role and I take it very seriously, is to really have a consistent voice and a trusted voice in this space, because there's so many inconsistencies in the concussion world.
Yeah.
And
That's
just to try to be
yeah.
a safe space for folks, both clinicians and patients.
Yeah, I find that challenging myself. It's getting a consistently good message out there, that one that you're comfortable with disseminating yourself, and that can be challenging because there's so much information, and we don't. Like, you're a doctor, so you know more than I do, but I mean, don't know exactly everything yet. So there's who says I'm not missing stuff, but I mean, I don't want to take that chance that I am missing. I am going to share information that may not necessarily be as solid and as consistent. If I just give everybody a chance to talk about what helped them, because what helped them may not help person A, may not help person B, and it's but if you can find something that helps person A a bit, helps person B a bit, or helps person A and person B up to person Z, but not person like 2, or so it gets. I'm making this more complicated than it needs to be, but I'll go back to another question about this. But who have you found any guests that have already not guests? I shouldn't put that on your burden with that one, but any topics that you find are most valuable to talk about on your podcast? Any topics?
Yeah, I mean, a lot of the consistent topics that I covered, one as being a physio, and two, someone survivor thriver who lived with post-concussive syndrome or persistent concussion symptoms. I still have a vision handicap with certain overhead lighting and things like that. It's really the rehabilitative nature of this injury. There's so many facets of this injury that are both central and peripheral. So central meaning your brain and spinal cord, and peripheral meaning everything outside of that, from your neck to your shoulders, if you God forbid had a whiplash injury, to the periphery of the vestibular system, and things like that. So what we found is that most folks have zero idea that concussion is a rehabilitative injury. So there's things that we can rehabilitate. And it's important to, yes, be an expert in certain realms, but making sure that we're looking at 30,000 foot views of these patients that come to us. So if they have a neck injury or a sleep disorder or a mood disorder premorbidly, to really understand what's happening with the patient before they had their injury, so we can rehabilitate them, as close to who they were before. And very important to understand as a provider that your patients are people first, and that they had a life before, and concussion is an injury of a loss of I am. Traumatic brain injury, the loss is I am funny, I am friend, I am social, I am doctor, I am teacher, I am mother, father, funny. Concussion can threaten all of those things. So once, people can kind of understand, where their patients are coming from when they're coming in, have they seen 10 providers before they've already seen you? Or are you their first one? And really making providers comfortable with saying, hey, you know what? I don't know, but let me take the time to reach out. Because a lot of people may have some cognitive dysfunction after this injury, just from a simple glucose, imbalance, a neurometabolic cascade imbalance. And hey, how has a medical provider that may be a little too busy in these day and age of 2020, how can we take the time to help our patients? And sometimes that's simply saying, hey, you know what, I don't know, but let me find the right people for you. And that's where we can do a lot of good versus harm. Where a lot of concussion patients have suffered, with getting mismanaged in the healthcare community.
In your own clinical practice, have you noticed any trends towards progression of this, of finding different people and accessing pathways for patients for rehabilitation? Have you noticed any trends toward that, toward being easier to do that?
It's actually still pretty tough. I live in New York City. I live in Manhattan. I'm born and raised here. I'm a local kid. The rent-controlled apartment. I'm never leaving type thing. And it's one of these things where I have access to the best in the world, right? But I actually still have a really tough time referring folks to people. I really have to vet and get to know. Sometimes we have, it's kind of like putting Picasso in the middle of Times Square. Sometimes you might have a really exquisite clinician who is very talented at what they do, but they may be in the wrong setting where they're seeing 4 or 5 patients an hour, and that's not going to be conducive to the patient's needs, their
Right.
rehabilitative needs, and I'm aware of that. So then I can't refer to that person. And so it's kind of like putting Picasso in Times Square and asking him to paint, 4 or 5 paintings an hour. It doesn't really work.
Yeah.
So it's just a matter of really vetting folks that I can trust. And that takes years and years and years of getting to know people and, just implicit trust. So wherever I refer folks, if I don't know, I actually say I don't know. I'm not going to refer you to somebody that's, another physical therapist or a neurologist or a physician of any other sort, pediatrician, that they have to be able to, I have to know that they can treat concussion, and then they have the means to appropriately care for the patient in front of them.
So if you don't know anybody, that you just look for just research and try to find someone for them. You
Yes.
don't just say keep going back here and we'll figure it out.
No. The blind referral is one of my biggest pet peeves, and we can't just refer someone and say, hey, they have a concussion, because I,
Yeah.
as a doctor of anything and someone who is both a survivor and thriver and a specializing person in concussion now, I need to know what the clinicians' belief systems and knowledge are of concussion before I refer to anybody, and that's on an international basis. So I have to understand, like, hey, are they 5, 10, 20 years behind the times of concussion research, and do they think this is primarily a psychological issue?
Yeah.
When we don't know what to do with someone in healthcare, we have historically sent patients down 2 trajectories. One, we've alluded it that they're malingering and they're faking it, or that we've alluded that it's all in their head and refer them to psych. Now, psychological things are very real, but I want to make sure that the patient in front of me, I understand that their anxiety, frustration, and fear is deriving from something somatic, like something physical that I could treat, or is it deriving from something truly psychological, where they had some premorbid issues and anxiety and depression and any other psychological disorders before their injury. Basically, whatever you had before a head injury basically gets worse. So if you had,
Yeah.
So it's kind of like putting gasoline on a fire. So we just want to make sure we understand who the patient is in front of us, who they were before their injury, and take the time to explore that, and then really understand what's been going on since the injury, and where things are basically decompensating, and how I can help them function in the environments that they need to function in.
Actually, speaking of that, can you do that? Can you do that for us on yourself now? Who are you before your injury, and what did your injury limit your abilities to do, and how injury recovery, your rehabilitation, in a reasonable amount of time. Obviously, not like in a 13-year time span. We can't speak forever, but give us an idea of who you were before your injury, and what your injury did to you, and any rehab steps that you took, and how it's worked out for you.
Sure. So I played a lot of sports as a kid. I was one of the kids who tried to sport specialize too young, and we didn't know any better back then. My mom was a single mom. She did a great job. She was at every sport I played. Even a lot of the practices, she'd bring snacks and give rides home to kids in New York City. So nothing to poo-poo there. But, as we've learned and grown, putting your kids in specializing them in sports really young can lead to a lot of overuse injuries. So I had, an ACL surgery my senior year, some other injuries and things like that throughout, a few concussions as well, from basketball and soccer. So I was not a good soccer player, but I was pretty decent in tennis and basketball and volleyball, and I played boys baseball until I was about 16.
Yeah.
So with that being said, I was a physical therapist. I was always active. I was usually pretty fit. Was a spin instructor after I had a few injuries with basketball and couldn't play basketball anymore. So I was kind of always on the go. What my injury taught me is to literally slow down. And I know people see me in the world and they don't think I I'm a very slow person, but I definitely take time to recover. So if I have a busy day on a Monday, I definitely take time to schedule that, and that has taken years to learn. I schedule in rest time for like a Tuesday or Thursday, so I'll see patients Monday, Wednesday, Friday, and then I just schedule academic time and podcast time and things like that for Tuesday, Thursday, and the weekends to just relax and chill. I definitely can't burn the midnight oil like I used to. I'm not sure if that's just being in my late 30s now, or if that's So, but I'm definitely very neurofatigue protective. I'm protective of my hydration, protective of my food intake. I respect a lot of the folks who look into the term hypochondriosis or the hypochondriac, but when you literally know that you don't function well without certain levels of hydration, or if you can't tolerate certain lighting or environments, you become a little bit hyper aware of your and protective of your functioning. So I'm just protective of my functioning, and I like to function as tip top as possible. I think just like anyone without a brain injury would, but we're just a little bit more mindful of where we put ourselves and feed ourselves and exercise and things like that. So I think that's important. And took me years to connect to, on how to really function at my best.
Right. Yeah. No, it does take a while. Actually, I was talking to someone about neurofatigue on Friday, because I did a podcast on Friday, but of course that won't be out until next Tuesday. This will be out. This is Monday, March 16th. This will be out on St. Patrick's Day. And
alrighty.
So, but we were talking about neurofatigue and how that's an issue. How she just sleeps however much she can, but she doesn't plan sleep. She doesn't say like at 2 o'clock I'll take a nap or whatever. But do you do that, or do you?
Oh yeah, I'm a napper for sure.
Do you set times to sleep, or do you just sleep when you want to sleep, or when you can't sleep, or do you have a schedule that I will now sleep between 2 and 3 or 3 and 4, whatever?
Well, I think it's different for everybody, right? So sleep is a very important thing. So it seems silly because sleep, I don't know, we've had this like assault on sleep the last 100 years. I don't know why. Even our president doesn't like to sleep, which might manifest itself in what we see on television sometimes. But sleep is something like oxygen. You really can't live without oxygen. And sleep is one of those things. You actually cannot function and live without sleeping, and sleeping well. So for me, I like to do things in 90 minutes. I feel like I get a full REM cycle sleep there. But then a lot of people also have hypersomnia or insomnia or difficulty staying asleep. So those folks might have different needs. But my needs are, I know I really don't feel rested.
What's hypersomnia?
Hypersomnia, you're too sleepy, so you can't even function. You can't keep your eyes open during the day.
That's right, okay.
Insomnia is you just can't sleep. And both of those things are not functional.
And hypersomnia and narcolepsy are not the same thing.
Correct. Yeah. So for me personally, I sleep. I tend to take naps in 90-minute bouts. So it's either 90 minutes or 3 hours. There's usually nothing in between for me. If I don't have time for that, I usually just push through.
Yeah, no, sleep is so great, but I find I can't sleep in as late. I do go to bed a bit earlier than I did have in the past. Obviously, when I was again in my 20s, like you were saying. I don't know if it's just the age thing, but I can't sleep in very late in the mornings. I find like 7 a.m. is like that's late for me. Well, not late, but that's I guess my average time. I guess.
Yeah, but I think if we think about it, like, we didn't really have lights until like 100 years ago, so we were kind of all candlelight, and
naturally. Yeah.
We literally, like, if you think about the spring flowers kind of wake up when we have more sunlight and a little bit more warm weather. Yeah. So I'm the same. I try to wake up with the sun. I'm pretty good at it, so I'll wake up around 7 a.m.
Yeah, exactly.
On days that I don't have to set an alarm to be somewhere, but exactly. I find what works best for for yourself, you've got to have to learn, and that might be doing that with someone who's a cognitive behavioral sleep specialist. I've had Katie Siang-Sakang, Dr. Siang-Sakang on my podcast. She's a cognitive behavioral therapist for insomnia, for sleep, and she's amazing. So she literally did her whole PhD on sleep, and that's where she specializes. And like a physio, sleep is functional. So there's certain things to help people sleep, making the room a little cooler, allow your body temperature to drop, which allows people to sleep, under the covers and things like that. So she's really wonderful. And, I take her quote 100%, and I say, you know what, your bed should really be for sleep and sex only.
Yeah.
So, and I really go by that motto because, once you start, watching television or getting on your phone, it might actually inhibit sleep cycles. So, if you do find yourself having trouble with sleep, give that a try. Your bed should be for sleep or sex only, and it takes about 17 days to form a habit. So give it a try for 2 weeks, and especially if you we're self-quarantined here in New York City. So
yeah, Canada's not far. It's Canada. Well, a lot of Canada's the same way. So. Yeah.
Yes, exactly. I think the whole world, and I think it's okay. I think it's okay to slow down. And I did learn that from my own brain injury is, it is okay to slow down. And now we seem to be doing it together as a world. So.
Yeah. It's out of necessity, but we're doing it. And so finally, just to ask you, what do you have coming up at Concussion Corner Podcast that listeners can subscribe and look forward to?
Sure. Yeah. I mean, literally, it seems so silly, but Nick knows this, and I surely know this, is that each podcast takes 3 to 5 hours to produce and put together and interview and just wrangle somebody down. Poor Nick had to wrangle me down to get to this podcast, but I'm so glad that I'm here. But everything takes about 3 to 5 hours of our time, and we do this for you guys for free. So literally just subscribing to our podcast wherever you listen to your podcasts, Apple, Spotify, Google, or Stitcher, wherever that is, iHeartRadio. Just subscribe, and then rating us 5 stars is so helpful to get people to know us and just tell one person about us. That's really the most meaningful thing that anybody could do to help us grow. It's Brain Injury Awareness Month, so thank you so much for having me on.
No problem.
This month, I hope St. Patty's Day, so I hope everyone has some soda bread and a tasty beverage for me. We just had a tremendous clinician scientist. She's actually really one of my favorites, and I have no shyness saying this, is Dr. Christina Master. She was just on. She's one of the heads of sports medicine in pediatrics at CHOP, Children's Hospital of Philadelphia. And she just did some tremendous research that she got an award for by the AMSSM in 2017. And it was basically showing that using near-infrared spectroscopy, that cognitive workload in healthy individuals without a brain injury or neurological injury, when a task got harder, their actual glucose and energy levels went down, which is a little counterintuitive. So if you think a task got harder, that their brain should actually
energy.
Use more energy. But they kind of assimilated to the task, and then that got easier for them, so they use less energy. What we found in that study is that with a concussed individual using that same task, the King-Devic test, their energy levels went up. So their oxygen consumption and glucose and things like that, everything went up. So what that really says was, that's one of the most important studies I've ever seen, because that functionally, explained why somebody around 11, 12, 1 o'clock is just wiped out, neurofatigued. In kids, we see that behaviorally with kids, and adults, we may see that, in sleepiness or just, getting a little agitated around those times. So really, really important work. And then coming on this week and next week, we'll have Ron Savage, who was the co-founder of the Brain Injury Association, International Brain Injury Association, NABIS, Pediatric Brain Injury Association stuff, and just does amazing work for us, for brain injury survivors internationally. And they'll be having a conference, if everything is okay, in August here in New York City. So that will be nice to help promote their good work and messaging.
It definitely will. So thank you so much. And basically, before I let you go, where can people find you and find Concussion Corner on social media, for example, or on the web at all?
Yeah, thanks for asking. So, Concussion Corners on Twitter, Instagram, and Facebook. I'm pretty. Let's see. Twitter is Concussion Corner without an ER at the end, so it's Concussion Corner, CORNR. So there's that, and it's at Concussion Corner spelled fully on Instagram. And we're just facebook.com, so fb.com/Concussion Corner on Facebook. So pretty easy to find. And I'm on all of those. I'm on Instagram and Twitter at DPT2go. So like Doctor Physical Therapy, the number 2 go, like stop go. So please say hi. If sometimes it's a crazy world and we're busy, but I always try to get back to folks. If it's not the first time, definitely the second or third time. So please, I'm not ignoring you. Just have a lot going on. So please say hello, reach out. Happy to cover any topics that people are looking forward to, and just really trying to support the concussion brain injury world the best way I know how at this moment, which is through this podcast and teaching, giving lectures to clinicians and hospitals and things like that. So
that's great. Well, thank you so much for being on, and I hope your podcast this week and next week, you said, go well, yes. And I'm sure it'll be sure to listen. So thank you.
Awesome. And thanks, Nick. And thanks for doing all the good work that you do. And really, it was a pleasure meeting you when we met. I remember coming back, doing my own rehab at that time in 2013, 2014. And you were one of my first online concussion buddies that I met. Mm-hmm. So it's really been a pleasure, still to keep in touch with all these years and see you doing well.
No problem. Thank you so much. Thanks a lot. No problem. Thank you all for listening. And please be sure to rate and subscribe to both Concussion Talk Podcast and Concussion Corner Podcast. Thank you very much. I hope you listen again soon. As always, the music at the beginning of this podcast is by Ben Sound. www.bensound.com.